Hi everyone. So my group did our presentation on fluid regulation. So we will each be talking about one of the body's essential electrolytes. I will be talking about sodium. Marissa will be talking about potassium. Nishita will be talking about magnesium, and Kylie will be talking about calcium. So sodium is essential for the maintenance of acid-base and fluid balance, active and passive transport mechanisms, and irritability and conduction of nerve and muscle tissue. The normal level of sodium in the body is 136 to 145. Hyponatremia is when a blood sodium level is less than 136. This could be due to excess water in the plasma or loss of sodium-rich fluids. Symptoms of hyponatremia include confusion, lethargy, seizure, coma, and death. Risk factors of hyponatremia include vomiting, diarrhea, nasogastric, suctioning, tap water enemas, excessive water intake, or inadequate sodium intake. Some nursing interventions include limiting the patient's water intake if the cause is due to fluid overload, and monitor the patient's input and output along with daily weights at the same time of the day using the same scale. In contrast with hyponatremia, we have hypernatremia, which is when a patient has a sodium level greater than 145. This could be because of excess sodium intake, fluid loss such as excessive sweating or watery diarrhea, and water deprivation. This is very dangerous because this imbalance can lead to neurologic, endocrine, and cardiac disturbances. Symptoms of hypernatremia include edema, decreased urine output, thirst, disorientation, muscle twitching, and muscle weakness. Some nursing interventions for hypernatremia could be administering fluids if the cause is due to fluid loss, or restrict sodium intake if the cause is due to the patient's diet consisting of too much sodium. Thank you.
Potassium, it's one of the major cations in intracellular fluid. It plays an important role in cell metabolism, transmission of cell impulses, for functioning of cardiac, lung, and muscle tissues, and assists with acid-base balances. The normal range is 3.5 to 5 millimoles per liter. Hypokalemia occurs when potassium levels fall below normal range in the extracellular fluid. The potassium moves from the cells while sodium and hydrogen ions retain within the cells, causing a pH imbalance and affecting most body systems such as the cardiovascular system. It can be caused from vomiting, gastric suction, diarrhea, or diuretics. Hyperkalemia occurs when excess potassium is in the extracellular fluid, which can be caused by renal failure or specific medications. This can be deadly as it causes muscle weakness and paralysis, later resulting in cardiac arrest if not corrected.
Calcium. It's found in our body's cells, bones, and teeth. It's important for the proper function of our cardiovascular, neuromuscular, and endocrine system. It's also important for blood clotting, as well as bone and teeth formation. Calcium ions determine the speed of the ion fluxes through our nerve and muscle cell membranes. Alterations in the normal balance of calcium affects our neuromuscular excitability, which affects everything from muscle movement to how our heart beats.
The function of magnesium is to regulate muscle and nerve function, to regulate blood sugar levels, blood pressure, and to make protein, bone, and DNA. There's hypermagnesemia, which is when there's too much magnesium in the body. That's going to look like having low energy, so your patient is going to fall into a coma, or they might feel drowsiness. You're going to have low respiratory rate, low heart rate, decreased bowel sounds, and decreased deep tendon reflex. And some risk factors are going to include increased magnesium intake, renal insufficiency, and diabetic ketoacidosis. And some management for that would be diuretics, IV administration of calcium chloride or calcium gluconate, to decrease the amount of magnesium within your food intake, and to do hemodialysis. And for hypomagnesemia, that's when you don't have enough magnesium within the body. And that's going to look like having a high heart rate, having a high blood pressure, having an increased deep tendon reflex. And risk factors for that would be not enough magnesium intake, increased magnesium excretion, intracellular movement of magnesium. And to manage that, you can take magnesium sulfate, by mouth or through IV. Take seizure precautions and increase the amount of magnesium within your diet.